Tonight on Diabetes Chat, we welcome back Liesl Richardson, a National DAFNE trainer and quality assessor, and also Louise Holland, who's the new National Director at DAFNE. Welcome to you both, and thank you for joining us tonight.
Hello, everybody.
Hi, everyone. Thank you for having us.
No problem. We always like to have you on. It's definitely not a problem. Okay, I'll start the chat then. Just going to do a quick 5-question session first. So could you both introduce yourself and give me a bit of backstory of who you are and what you've done in the lead up to working for DAFNE? Louise, do you want to go first?
I will. Thank you. So, hello, everyone. So I trained as an adult nurse. Started my training in 1996, and then I went on to become a midwife and then a specialist community public health nurse, which is the new title for a health visitor. So I did that for quite a number of years. Then I worked for children's services at the CQC. So I'm not sure if you've heard of the CQC. That it stands for the Care Quality Commission, and they regulate health and adult social care services in England. And I managed a national team there, and we visited local authority areas in England to see how well the needs of children and young people with special educational needs were being met. I also worked for NHS England, where I was part of a team working on improving health outcomes for people with a learning disability and autistic people. And that's quite important when we think about diabetes, because we know that people with a learning disability have a slightly higher chance of developing both type 1 and type 2 diabetes. And sometimes people with a learning disability can experience barriers when they're trying to access healthcare. So that's a little bit about me and what I did before I came to DAFNE.
Liesl, do you want to answer that question?
Yeah, thanks, Claire. So I'm Liesl. I trained as an adult nurse. I started my training in 1987 and then moved from London up to Norfolk when I married my farmer husband and got a role as a diabetes link nurse purely by accident. As some of you will know, I was a specialist nurse called Jan Armand. And I just thought I have to do this and I have to work with Jan. And I got a job as a diabetes specialist nurse, which I did from 1999. And then I was told I was going to do my DAFNE training in 2005. And I just thought, oh, it's going to be rubbish. But hey ho, we won't have to keep doing it if it's really rubbish. And actually, here I am 20 years later, and now I work full time for DAFNE. And I'm happy to talk to anybody about DAFNE and Victor, whoever wants to listen to me. And even if they don't, I'm happy to chat about it. So that's me, really.
Thank you, Liesl. Louise, why did you want to work for DAFNE?
Well, I saw the role advertised and I started to do some research on DAFNE, and I was so impressed by the very positive feedback people were talking about who had completed the course. So people were saying things like they'd lived with DAFNE for over 30 years. Sorry, they'd lived with diabetes for over 30 years, and then they'd done the DAFNE course and it had completely changed their life. And I'm sure you know, when people complete the DAFNE course, they're asked to complete a survey, and they're asked to do that before they start DAFNE, after they finish the course, and then a year later. And some of those comments are on the website, and they're just incredibly inspiring. When I looked into DAFNE a little bit more, I realized that it was about the principles of group learning, and it was about equipping people with the knowledge and skills so they could manage their own diabetes and make their own choices about how they wanted to live their life. And that was very important to me, and it aligned with what I'd learned as a public health nurse. What I'd learned was effective. So that's why I saw the role, I looked into it, and I was just very, very keen to come and work for DAFNE. And I'm really glad I made the move.
And what does your role actually entail, Louise?
So it's a little bit of everything, really. So overall responsibility for the programme, so supporting Liesl and our other national trainer, Bev, to continually produce new materials and updating um, and new programs. Um, a lot of talking to people about DAFNE, because we want as many people across the country to be able to access DAFNE. So talking to health professionals about it, asking them if they want to bring DAFNE to their hospital trust or their organisation. Some things that I'm not that keen on, sort of doing the budget, which is really, really important, but I always find that quite boring. I like to be out and about talking to people. And one of the main things I'm doing at the moment is thinking about the strategy for the next 5 years. So it's really important to me that we hear the views of people with diabetes who have done the DAFNE course, and people who maybe want to do the DAFNE course, Victor, and hearing from them what their ideas are, because we need to think about where we want DAFNE to be in 5 years' time.
Okay, thank you for that. That really does sound an interesting job. What motivates you in your work, and why do you want to help others with diabetes? I don't mind who wants to answer that first.
I'll jump in there, shall I, Louise?
Yeah.
I think one of the best things about being a diabetes specialist nurse, it's the best and the worst thing really, is that the more people you meet who have type 1 diabetes or type 2 diabetes, the more I realize I don't understand it. And yet, with the more people I meet, the more I learn. So it's almost like the more I learn from people who live with diabetes, the less I think I know. And so that keeps me motivated to provide as much information as people. I've seen too many people who have had to work out how to self-manage their diabetes with very little support because things aren't provided in their area, or they're just, the waiting list for things are too long. And I think the more we can do to help people understand a condition that they've developed through no fault of their own, and if it's type 1 diabetes, I can't take that away, but if I can make life a little bit easier for somebody, then that's what I'd like to do. And then about 15 years after I became a diabetes specialist nurse, my niece was diagnosed with type 1 diabetes. And for me, that was another whole new experience of watching the impact on her, my brother, her mum, and even my parents as her grandparents, how worried they were about what they could give her to eat and whether they could take her for a walk. And I have to say that in all those years, I'd never considered the impact on the wider family. And that's my motivation, I think. And through DAFNE, and hopefully now through Victor, we can support people who are going through that really dicey, anxious phase of not really understanding or knowing the best way forward.
That's brilliant. Louise, have you got anything to add to that?
I think Liesl and I are both nurses, and it's something about you go into nursing to try and help people, but then you realise that actually giving people the information and the power to manage their own condition is the absolute best solution. So what we are, if healthcare professionals have that information, we need to share as much as we can with the people who are living with the condition, so they can self-manage.
Yeah, I totally agree there. I mean, I've been diagnosed 30 years this year, and I've just taken part in my local Victor pilot, and it's really opened my eyes, and I have
Really?
learnt such a lot. We'll move on to the next session now, unless you've got anything you want to add to me.
I was really keen to
I was
hear
going
what
to
you
say, Claire,
thought.
I'm happy.
Oh, sorry, Liesl.
Yeah, I'm happy to sit here and listen to what Claire's got to say, because you'll be the first person I've spoken to who's actually done the Victor course in the pilot. So I think me and Louise will be happy to hear what you've got to say, Claire.
Yeah, I'll fill you in a bit when we get a bit further on.
Great.
I tried to actually get the lady that had taken part in the pilot with me and one of the educators on, but unfortunately they couldn't make it tonight.
It's a shame.
So we'll move on to what Victor actually is, for the people that are listening or live or listening to the recording later on. to help them understand what it actually is and what does Victor stand for and what was the inspiration behind developing the course. Don't know who wants to answer that first.
I'll let Liesl answer that. Liesl is the expert.
Okay, yeah. So VICTA stands for Varying Insulin Doses for Changes to Routine. And it's for people with type 2 diabetes who use multiple daily injections of insulin. So they might be on long-acting insulin and one or more injections of quick-acting insulin with their meals. I think that we've got DAFNE for people with type 1 diabetes. There are other structured education courses, some local, some national around the country for people with type 1. And there are courses for people with type 2 diabetes, but not many, if any, that really focus on people who take multiple daily injections. So we wanted to use our experience from DAFNE and very specifically our DAFNE philosophy. So our DAFNE philosophy is that as the person with diabetes, you should be front and center in the decision making process about your diabetes management. And we wanted to use that philosophy in a course that would empower people with type 2 diabetes on multiple daily injections. So that was really the kick that we used to launch us off with Victor.
Thank you for that, Liesl. It's definitely a good course to go on. I thoroughly enjoyed it, and like I said, I learnt a lot.
Great.
So the Victor symbol for Victor is a ship's wheel. How did that come about? What made you decide to use a ship's wheel?
Do you want me to take that one, Louise? I'll take that one. I think Louise is still on.
Sorry,
on
couldn't
mute.
get off mute. Yes, go on, Liesl.
That's right. Yeah. So we thought a ship's wheel really represents a journey, it represents a journey, a direction, making choices to go in certain directions. And we thought that that's what self-management of diabetes is, whether it's type 1 or type 2. But for Victor, we thought this was a way for people with type 2 diabetes to choose the direction they wanted to go in with their self-management rather than just being told what to do by healthcare teams. So it's a great for a visual resource as well. It's a really clear, crisp symbol, but it's also the basis for the main values of the course. So we've got something called the Smart 7, which is a way of looking after ourselves and increasing our insulin sensitivity or decreasing our insulin resistance. And the Victor Wheel of Health, which is about 7 aspects of good health and how we might want to manage those ourselves if we've got type 2 diabetes. So it's about a journey, choosing the direction you want to go in and using those 7 spokes as your basis for good health, really.
Okay. I learnt about the Smart 7 in the course and I found it really useful.
Yeah, it's so simple. It's a simple concept, isn't it? And it really shows you that our health is not just about insulin injections and glucose checking.
Definitely does. When you were adapting the course for type 2 diabetes, what sort of changes did you make putting the course together? From the DAFNE course?
Yeah, it's a lot more visual. We wanted it to be available to a much broader range of people, so different cultures, different levels of education, all sorts of reasons. We just want it to be more accessible. So we were lucky enough to be able to get lots of videos made so people can watch and listen to a video rather than having to read so much. I think there's about 20 videos in the course altogether that really emphasize the key messages of Victor. So because it's so visual, we think as adults, and I'm one of them, I think I learn much more through visuals than I do through reading. So that's what we kind of wanted to do with Victor, was make it much more accessible. So that's one of the major differences between that and DAFNE.
I'm also somebody who learns better and more with visual So I found it. I'd done one of the courses for type 1s online. It wasn't Daphne, it was another one, but I'm dyslexic as well, so a lot of reading and a lot of watching, well, not watching the videos because that was brilliant, but just reading so much information. I kept finding rereading sections that hadn't gone into my dyslexic brain.
Yeah.
So one of the topics on the Smart 7 is smart eating. Could you tell the community what is smart eating? I don't know who wants.
Louise, do you want me to take that one? Do you want to do that one?
Yes, so smart eating, that focuses on how to plan meals which include carbohydrate foods, but in a way that reduces the rise in glucose after a meal. So we talk about the carb smart way to help with that. So Lisa and I will try and tell you some of the steps of the carb smart way. So the first step is about the type of carbs. So it's about choosing carbs that are digested more slowly. So for some examples, you might choose seeded or multigrain bread instead of white bread. And you might choose jumbo oats instead of cornflakes or basmati rice instead of instant rice. So it's just those slight switches when you make a choice to try and choose a carb that's going to be digested more slowly. Step 2 is about the amount of carbs. So it's just about being mindful of the size of your carb portion. So the bigger the portion of carbs you have, the more impact it's going to have on your glucose. So it's about using some simple ways to estimate your portion size. So there's some handy measures to try and get around 40 grams of carbs. So that for some carbs that'll be a quarter of your plate, or it might be looking at the size of your fist and trying to get a fist-sized serving. Do you want to do step 3, Liesl?
Yeah. So step 3 is about meal preparation. So if your carbs are only going to take up a quarter of your plate, you need to think about what else you're going to add to your meal. So if you plan your meals, so half the plate is vegetables, a quarter is carbs, and the other quarter is healthy protein, then you get a really nutritious, healthy, satisfying meal. But also adding protein and those fiber rich foods like vegetables will slow down the digestion of your carbs. So that will slow down the rise in your glucose. So that kind of meal prep is a really useful way of meaning that you don't need potentially as much insulin or so much insulin so quickly. So it could be really useful in helping to manage your glucose levels. And then step 4 is about the timing of carbs. So trying not to eat meals that are too close together, because then you might have carbs going in quite close together. So that means you're going to maintain a raised glucose level, but also not leaving meals too far apart. Because if you don't eat for hours and hours and hours, you then get so hungry that there's a temptation to fill up on carbs because you're so hungry. And then that bigger portion is going to raise your glucose levels. So it really is about making different choices if you want to about the type of carbs you eat. It's about the amount of carbs so that you're not causing too much of a rise in your glucose after meals, what you add to those carbs to help that meal be nutritious but also good from a diabetes perspective, and then the timing of those carbs and making sure that you're not eating too close together or too far apart. So that's what Carb Smart is all about.
Thank you for that, both of you. It certainly opened my eyes when I was doing the course. And I know that the lady that was doing it with me, she works shifts, and she was saying that she really struggles sometimes with her levels being really high. And when we discussed it within the group, it was the fact that she was eating too much carbs too close together.
Right.
Yeah.
And what did you think about the switches? Have you been able to do any of them, or do you think they're achievable switches?
Yes, I mean, I've started to try and eat more vegetables and less potatoes.
Right.
So yeah, I'm finding that it is helping me with my levels. And when I was in Glasgow a fortnight ago for the DUK conference,
Yeah.
I hardly needed any quick acting insulin that 3 days that I was there because of the amount of exercise that I was doing.
Right.
Yeah.
Walking up and
It
down.
was a huge
It
place, wasn't it?
was. I missed you. Tom did say that he'd seen you, Liesl, but I missed you.
Yeah. I didn't see you there.
So, but yeah, it was good, and it was certainly a learning curve for me that 3 days. Because I kept going hypo and kept thinking, well, why am I going hypo? And then
Right.
I looked and I thought, it's the amount of walking you're doing, Claire.
Mm.
Yeah.
It was a huge conference, wasn't it?
Yeah.
It was.
It was. Yeah.
Um, with the focus on food, would you say that Victor is a weight management course?
No. We tried to make Victor weight neutral. So there isn't a focus on weight loss as a way of improving type 2 diabetes. So I think our ethos is that the path to better health really is to focus on healthy behaviors. And that's where the Smart 7 comes in that you will have learnt about on your Victor course. So the Smart 7 is about some lifestyle choices that we can make depending on our abilities really and our lifestyle and our other commitments. So for example, it could be if you sit down a lot, maybe you want to stand more. If you stand a lot, maybe you want to step more, so you want to walk a bit more. If you walk a fair bit, maybe you want to do something that makes you sweat a bit, so we've got standing, stepping, sweating. And then there's smart eating, so the carb smart that Louise and I were just talking about. Sleeping, having a good routine at night, having good sleep at night helps to reduce our insulin resistance and increase our insulin sensitivity. So good sleep is becoming more and more vital and more and more understood in its relationship to type 2 diabetes. And then there's self-care, so making sure that we look after our own well-being, and then connecting, having social connections, social support, family support. So the Smart 7 really is the focus, not really about weight loss. Yeah, that's what I would say about Victor.
Thank you for that. We've had a question come through from Kez while we're talking about food. So she's saying, within Victor, do vegetables not count as carbs? It's always one that's confused her whether they should be counted or not. And she's loving the insight
Yeah.
this evening.
Thanks, Kez. In DAFNE and in Victor, we don't count vegetables. The only vegetables that we count as carbohydrate are potatoes and sweet potatoes. Other vegetables, even things like parsnips that you might think of as quite sweet, or carrots, they have such a complex carbohydrate that we don't digest them very quickly. And if you were to take quick acting insulin for those vegetables, the insulin is likely to work and drop your glucose and give you a hypo before the small amount of carbohydrate or glucose that's in those vegetables would make any difference. So in DAFNE and in Victor, the only vegetables we would count would be potatoes and sweet potatoes. Every other vegetable is, you can eat that without taking quick acting for it if you're doing DAFNE or Victor.
Hope that answers your question, Kez. Thank you for that, Liesl.
Great. Thanks, Kez. It's a good question.
My next question, what reaction have you had from participants and educators so far? If
Shall I
any.
answer that one, Liesl?
Yeah, please, yes, do, because I haven't seen that feedback
so
yet.
We've just finished the pilot, and we're just collating all the feedback that we've collected from everybody involved. So we asked the educators and the participants, people with diabetes doing the course. So the educators who undertook the training for Victor and who delivered the pilots were very enthusiastic about the course. They valued that the course included things we know are important for supporting people to change their behaviours. So discussing emotional health, thinking about diabetes stigma, how to get helpful support from others, and breaking down long-term goals into small, achievable action steps. Victor doesn't just focus on physical health, it looks at emotional health equally. We know that's equally important. And the feedback from people doing the course has been very positive too. 100% of people doing the course said they would recommend it to somebody else with type 2 diabetes. So overall, the reaction has been incredibly positive. That we know from the pilot we want to change the order of some of the modules, but the actual content, everyone has thoroughly enjoyed doing it and has found it really useful. So we'd really love to hear if anyone else on the call has been involved, or if you've got any more feedback about it. We're really keen to hear it.
Well, I think there's only me that's actually type 2 that's on the call at the moment.
Oh, right.
We've had another couple of comments come through on the chat. Gillian is saying that it's interesting, and I'm just trying to find it, I've lost it. Interesting about the food swaps, and she adopts that for her type 1 management of food and insulin, keeping a close eye on carbohydrate, choosing slower release, and eating smaller meals but regularly. And she's also saying cornflakes are completely off her list, all too fast.
Right.
And then Tom has asked a question saying, can you recommend any slower acting carbs?
So slower acting carbs would be sort of whole seeded breads, because they are not absorbed quite so quickly, and whole meal, so like whole wheat pastas, brown rice, things like that are usually absorbed more slowly. And the less processed something is, then normally that's going to be more slowly digested. So if you have a jacket potato, for example, that's probably slightly more slowly digested than mashed potato, because if you mash it, you've already started to break it down. So there's a number of, and like I think Louise said, basmati rice is more slowly digested than normal long grain rice or instant rice, so things like that. But the other thing that I learned through Victor, which I didn't know before, is that if you freeze, say for example, if you have some lovely multigrain seeded bread and you've kept it in the freezer, when you defrost it and eat it, once it's defrosted, it's absorbed more slowly than if you eat it fresh. And I was talking to one of my DAFNE graduates a few weeks ago, and she said, well, I make my sandwiches on a Sunday and I put them in the freezer for the rest of the week. She said, but if I eat the bread as toast in the morning, I get a real spike. But when I eat the bread at lunchtime that's been frozen, I don't get a spike in the afternoon. She said, now that explains why I get a spike in the morning and not in the afternoon. So there's little hints and tips like that, I think, which are dotted all through the Victor course. But Claire, you'll be able to come back and tell me if that's right. But those little hints can be really helpful, I think.
That certainly was mentioned and discussed as to how different ways of presenting potatoes and things like that could help you out. So we're having lots of comments coming through that I'm trying to keep an eye on whilst looking at the questions to ask you. Kirsty's asking a question. She missed the start, so apologies if it's already been covered, but I don't think it has. Her mum's recently been diagnosed type 2. Is there an estimated time when the course will be rolled out within the NHS, and will it be released in Scotland?
So any centres who already run DAFNE, they can opt to train up their existing DAFNE educators to run Victor, and we're going to start doing the training for centres from early summer. So if you're under the care of a centre that runs DAFNE, it might be just worth asking next time you have your appointment, or before, if your appointment's not for the next year or so, just to see if they're planning to run courses and when, and how to get onto one of those courses. We do know that there's some nurses and dietitians who are not DAFNE educators who would like to run Victor courses for patients. So we are looking at how we can separate the training out, so more people can train to do this if they want to, and that would help Victor be more available across the UK and Ireland.
That was my next question, actually. As a person who's participated in the pilot in my local area, I would be interested in becoming a Victor trainer. How would someone go about becoming a trainer? What skills and qualifications would they need?
Well, at the moment, the trainers are all either registered nurses or registered dietitians. But it's a really interesting point about who else could train, and is there some sort of peer support role? That's definitely something we could have a think about.
I would definitely be interested, but I am a registered nurse, although it's a
Oh,
learning
well,
disability nurse.
right. Well, there's two things I'm thinking there, because so at the minute, so if you're part of a DAFNE centre, if you're employed by a DAFNE centre, um, that would be the way to do the training. At the minute, we do ask that people have a specialism in diabetes, but we could definitely have a conversation, because my background is working with people with a learning disability too, and we know that the some of the courses, I think we could increase their accessibility for people with a learning disability. So perhaps offline we could have a chat about how
I'll
we could
email
do
you
that.
tomorrow.
Yes, yeah, definitely. Because I'm sure in some, in my mind, some centres might want to run a course. It might have to be a little bit longer, or there might be some reasonable adjustments that have to be made. But if people with a learning disability who also had either type 1 or type 2 diabetes wanting to do one of our courses, it will be interesting to look at what we need to change to make that more accessible.
Thank you for that. But yeah, I'll definitely be in touch with you, because it is something that I'd like to do. I mean, 2 years ago, I wouldn't have been doing this tonight. So
Right.
I've come a long way with wanting to help people. And if I could take that a bit further by doing some more qualifications and gaining some more skills to be able to help people with learning disabilities who have got diabetes, that would be fabulous.
Yeah, because really we need, on those courses, wouldn't it be great if we could have a learning disability nurse with all of those expertise, and a diabetic specialist nurse or dietitian with all of their expertise working together? That would be fantastic.
That would be fantastic. We've had two more comments about food. Kirsty's saying that the frozen bread thing was a game changer for her, and same with cooking pasta twice. And then Gillian says, our discussion around resistant starch, I find chickpeas, lentils, etc., are a good idea too.
Oh, great.
Yeah, they're really good, and sometimes you don't need quick acting insulin with chickpeas and lentils and beans and things, because they're so slowly absorbed. So they can be a really good choice. Yeah.
And another one's just popped up from Kez. If I can find it, I've just seen it. Allied professionals and peer support with both DAFNE and Victor would be such a good idea. She's a social worker and specialises in mental health and children and disability, and she'd love to get involved too.
Oh, fabulous.
And then I've
We've
had
got
a message come through from James, who's a DSN in Leicester, saying it's worth mentioning that someone who is newly diagnosed, not on multiple daily injections, could consider structured education, Desmond, or even the Path to Remission Diabetes program.
Yeah, absolutely. Because Victor is for people with type 2 who are on long acting and quick acting insulin. And so for somebody who's newly diagnosed, yeah, absolutely, James. Either the remission program or something like a Desmond course would be great.
My last question before we go on to me sharing my experience of the course, and then we've got some other community questions come through. My last question is, do you think it would be good to hear and see lived experiences of people sharing their experience of doing the course to help others when thinking about doing the course, or hear it at the start of the course? So if you starting a course with somebody maybe like myself who's got type 2 diabetes, to go in and talk to them about my experiences or their experiences.
I think having somebody's experience of attending any kind of structured education course is so important and so valuable. And sometimes I think it's once you've got somebody on a course, they're there because they want something to be different. I think where your lived experience is so powerful is when you meet people before they've made the decision to go on a course, because all of you are used to going to clinic and a healthcare professional telling you what's going to be good for you, but actually you want somebody to listen to what you need and what you want, and somebody who's done a course is going to know how it helped them, and therefore they know how it might help you. And I think it's much more powerful hearing somebody with that lived experience to help them make a decision to attend or not. Certainly I've seen that happen when I used to run recruitment evenings for DAFNE. I'd have 2 or 3 of my DAFNE graduates would come along, and I'd welcome everybody, and the doctor would chat for 5 minutes, and then we just opened the floor, and our DAFNE grads would answer all the questions that came from all the people that had been invited. And that was the most powerful thing of all, because you it's a bit like when your teacher tells you to do something, you don't want to do it, but when your friend tells you to do it, you'll do it. You need somebody that understands where you're coming from to really listen and let you know what's useful or not. So that's, I think, lived experience is ideal. Yeah.
I think it's a good idea as well.
Yeah. Sorry, I got a bit waffly there, but, but essentially, yes, I think it's a great idea.
Okay, we finished that section of the evening. The next thing I'd got on the list was for me to share my experience of the course and to ask if anybody had got any questions of me. As I said earlier, I've been diagnosed 30 years this year, and up till going on the course, my colleagues and my friends always used to say to me, well, you're the expert, you're living with it. And I went to the course, and it was really good. Just learning about different things and having the visuals and having the resources to be able to check back if there was something I wasn't too sure of or didn't understand, and having the videos and listening to the different bits of the topics were really, really good. For someone who doesn't, how am I trying to word this? I don't learn a lot by just looking at something and reading it because of my dyslexia.
Mm.
So having the videos there and them not being too long, I felt I was really learning something. And I also learned about the type of insulin that I'm actually on that probably wasn't explained to me at the time that I actually went on that brand of insulin, how long it actually lasts for. I had to undergo surgical procedure, and the hospital themselves had turned around to me and said, stop your long acting the night before your procedure, or if you have to, just reduce it to half. Well, being on an ultra long acting insulin, I found out after the first time that the procedure had failed. I found out from one of the diabetes nurses that was running my course, no, you should have reduced that 4 days before your procedure, not the night before. So I've been able to pass that information on. So I really did.
It's so powerful, isn't it, Claire? I think if it's something, it's a medication that you're going to have for a long, long time.
Yeah.
And to understand exactly how it works is liberating in a way, isn't it?
And I mean, we're all aware of the sick day rules for when you're not feeling very well. But another thing that I actually learnt is a medication of metformin that I don't actually take because I can't tolerate it. But even if I'd have been on it, I wouldn't have realised that if you've got sickness and diarrhea, stop taking your metformin or your SGLT2 medication. That was something I learnt as well.
Yeah. That seems so important. Yeah.
We've had another question come in. Can you explain a little bit about the different modules within the Victor course?
So there's different modules based on carb counting. So different ways to carb count and how to get the most out of the carbs in your meal. So like we were talking about Carb Smart. And the course is done, there's some online. So there's some learning to do online each week. And then you have a group session with an educator in a small group each week for 5 weeks. So there's carbohydrates, there's insulin dose adjustment, how your insulin works, how to work out how much insulin you need for carbs. And there's the option to do ratios, so insulin to carbohydrate ratios, which is very similar to type 1 diabetes. Or there's the option to use set doses of quick acting insulin, and then you would have set amounts of carbohydrate. So, for example, if you always have 2 Weetabix for breakfast and a banana, then the chances are that you're having the same amount of carbohydrate every morning for breakfast. So you could take the same dose of insulin every morning. And if you decided, if you're Gillian, you wouldn't because you wouldn't eat cornflakes. But if you decided to have cornflakes one day, as long as you have the same amount of cornflakes with the right amount of milk to bring you up to the same amount of carbs, then you would just take the same dose. So people are free to choose how they want to carb count. And then other aspects are about managing activity, managing illness, as you mentioned, Claire, which is so important to understand the ins and outs of that. So alcohol, eating out, or just things that impact in life and how to manage your diabetes around those things. Yeah.
Thank you, Liesl. Another thing that I actually found really useful on the course was the activities that are in the book that you work through, and you do the activity, but then the answers are in the back so that you can see whether you've got them right. And I was good. I didn't cheat.
Oh, good for you.
We've had another question come in. How soon after diagnosis would you recommend that somebody did a Victor course?
So Victor is for people that are on multiple injections of insulin a day. So you could be diagnosed with type 2 diabetes and never go on insulin. You might be diagnosed late on in your type 2 journey, if you like, and be on insulin quite quickly. You might end up just being on 1 injection a day. So really it depends on if you ever get to the stage of needing long acting and quick acting insulin together. And then I'd say if you could get on the course as quickly as possible, because the sooner you get on it, the sooner you'll understand the medication that you're taking and how to get the best out of it.
I totally agree with that, Liesl. I've been on both insulins for probably about 10 years.
Mm.
And I think I would have found it a lot easier to manage my diabetes. If I'd have done, if the course had been around when I first went on to both lots of
Mm.
insulin.
Mm. I think access to education is so powerful and so important. And we think about access to medications and how quickly and easy it is to write out a prescription. I think in my ideal world, your GP would be able to write you out a prescription for some education and you could just go and get it. Wouldn't that be great?
That would be
Yep, here
absolutely
you are.
fantastic.
Here's a prescription for a DAFNE course. Here's a prescription for a Victor course. Here's a prescription for Desmond or whatever. That would be marvelous, wouldn't it? Yeah.
We've got some more some community questions. What are the benefits of this course for the people doing it, and also for the clinics, NHS? Any outcomes? And have you got any specific statistics or feedback to share yet regarding the Victor course?
So we haven't got any clinical outcomes yet because we've asked people to check their blood glucose levels before the course, after, and then we're going to measure a year after as well because we want to show that any change is long lasting. So we'll have to wait a little bit for those to come through. From the feedback that people have given us, I would say the benefits to people with diabetes doing the course, that's around people feeling that they feel more empowered, they feel that they've got more knowledge and that they feel more in control of their own diabetes and that they're able to tackle certain issues. So some people are talking about specific issues that they've had that the course has helped them to overcome. So that's really positive to read. Benefits for the NHS? Well, we know that if people can maintain more time in their target range, we know that that means that there's going to be less complications later. So long term, we really feel that this course will benefit the NHS in that way. But ultimately, the most important thing is for the people doing the course, for them to feel more in control and to have better results, to get the time and range that they want to achieve. Do you want to say anything else there, Liesl?
I think yes, I would echo everything you've said, Louise. It's about the individuals with diabetes actually having a healthier life, that they're living how they want to live. The knock-on impact of that on the NHS is reduced amount of long-term complications. But it's a bit like wearing a seatbelt. You never quite know. You see things improving, but you never quite know who you've helped, because it's a safety belt for diabetes, really. So yeah.
Yeah, and I think I'm talking about people's blood glucose, but actually it's about how happy they feel and if they're able to feel that they're living the life they want to live and
Yeah.
obtaining the targets they want.
Because we know people with diabetes or any long-term health conditions can be more susceptible to um, anxiety and depression associated with their long-term condition. But if we can help alleviate that, reduce the burden of living with diabetes by providing information and empowering people with these choices, then that's got to be a good thing. We hear about diabetes burnout a lot, don't we? And it's something that we're always very conscious of. So I think emotional health, as Louise said earlier on, is equally as important as physical health. So if we can help people with that, then that is fantastic, I think.
Absolutely.
Yeah, it reduces the anxiety and some of the burden as well. And it's certainly
Yeah.
given me more confidence in managing my diabetes and improve my mental health.
See, I always did get a reputation as a crier when I was delivering DAFNE courses, because I always get emotional when people start talking about it. And I have to say, Claire, you're making me feel emotional.
Sorry,
I'm
Liesl.
still a crier. No, it's all right. I'm still a crier.
I read some feedback from someone who completed the DAFNE course. This was DAFNE, not Victor, today, and they said for the first time in however many years they were able to have a lie-in and enjoy a meal out, and that really got me because those are two things I absolutely adore doing. And I just thought, what other, you know, what other condition makes you think you can't have a lie-in or a meal
Yeah.
out? But Daphne gave them that choice back.
Just a comment from Tom Liesel. He says, "Don't cry."
I'm afraid it's built in. It's built in, Tom.
You mentioned a 5-year plan, Louise.
Yes.
Do you have any
Yep.
early ideas of that you could share?
So we want to increase access to Daphne. So we want anybody who wants to do Daphne to be able to do it. So my job is to um, encourage hospitals that aren't doing Daphne to do it. We want, we've already touched on this a little bit, to improve the accessibility of Daphne. So we know in Victor we've got the videos. So if you prefer to learn by watching a video, you can do that. If you prefer to learn by reading, you can do that. And then we've got the group work, and I think that's really important because everybody learns differently. So I personally, information doesn't go into my head until I talk about it. So the group would be really, if I was doing it, I know the group would be the part that helped me learn the most.
I
We
found
know
that as
we've
well.
Did you? Great, great. I think it's when other people say what's helped them, it's a bit like what Liesl and you were talking about earlier. That does stick in your brain, doesn't it? But more than if someone says, "Oh, just do this."
Yeah.
It's
Yeah.
hearing the story, isn't it?
The lady that was actually doing the course with me, she used to eat and then do her insulin, and she was wondering why her levels always went quite high after she'd eaten. And I said to her, "Have you tried injecting before you eat and see whether that makes any difference?" She tried it for the second week of the course. When she came back
Right.
on the third week of the course, she said, "Claire, I can't believe I hadn't done that before."
Yeah. Yeah.
It had made a difference.
Yeah.
And she was waiting to go in to have an operation. So she was trying to lose weight, and she'd actually lost, I think she said, 6 pounds in the first 3 weeks of the course.
Wow.
That's brilliant.
Wow.
So
That's
although
really
it's obviously not seen as a weight management course, she had lost some weight and she was pleased with that.
Yeah.
One of the other things that we were told by the DSN and the dietitian who were running our course was, don't aim to do too much too soon.
Yes.
If you don't do any at the start of the course, and by the end of the course you're doing a little bit of exercise or a little bit more movement, that's still an improvement to what you were doing. So don't get
Yeah.
disheartened.
Yeah.
Yes. Yeah. I really like that. There's a bit on the Smart 7 where it says if you sit, try and stand. And just those little incremental
Yeah.
changes. There's
Yeah.
something about that really works for my brain, because if something looks like it's a big change, I immediately think, "Oh no, I'll do it later." But that little, those little incremental changes, I think, "Oh my, well, I could do that." So actually,
Yeah.
after I read the Victor course when I joined, I started to I've got my desk raises, so I started to stand up a little bit during the day at work rather than sitting all day. So I made a little change.
Well, of course, I'm not working at the moment because of complications of my diabetes. So
Yeah.
I am sitting a lot. And when they said about just standing up for 5-10 minutes at a time, that's what I used to do. And then I started every half an hour, maybe going for a walk down the hallway, which I've got quite a long hallway in my flat,
Yeah.
and then coming back and watching a bit more telly and then going and walking again.
Yeah.
Yeah.
Tom
And it
says
all
he's
helps.
standing now.
Well done. Well done.
I think the important thing is that we all know what our own lives are like, and we all know what time we've got, what motivation we've got or not got. We all know what encourages us and what discourages us. So for a healthcare professional to tell you that you must be doing this many steps a day, or you must be doing this many hours of exercise a day, there are times when you just think, that's just not realistic for me. And I'm like Louise, I love the Smart 7, because it is, if you sit a lot, stand more, if you stand more, walk a bit more. They're small things that are not overwhelming. And I think therefore they're far more achievable. And you might decide that actually perhaps the moving things are not something you can do because you might have a sprained ankle or something. But if you could sort out your routine before you go to bed so that you sleep better, that's still something positive, even if it isn't something that traditionally we would think of as great for your diabetes.
Absolutely.
Yeah, definitely. I'm very conscious that it's 25 past 9 and I've still got about 6 questions to ask. Are you both
Ask away.
you both okay for time?
Yeah, I'm fine.
Okay.
Yes, yes.
Well, as a peer support group that we are on Diabetes Chat, what are your thoughts on peer support and how do you think this course helps with peer support and with connecting people?
This is Liesel's absolute
Yeah.
favourite topic, so I'm going to let you answer there, Liesel.
Thanks, Louise. I think that peer support is the unsung hero of diabetes education. I think we could sit you down in front of all the Victor information on your own, and I don't think it would be as successful as it is when you do it with somebody else who's got diabetes. Um, and I'm going to tell you the story I might have told you before, but I think my second ever DAFNE course that I delivered was back in 2007. And it was the chattiest group I have ever had. And they decided to meet for lunch on a Saturday, a couple of months after the course, just to catch up with each other. And they still do that 18 years later. They've had 18 years of peer support, meeting up every 2 or 3 months for lunch. Their age range is between 40 and I think 85 now. And they invite me along now because I'm not their DSN anymore. And they spend a few minutes talking about their diabetes, their latest CGM, whether they're on Libras or Dexcoms, whether they're on pumps or injections. But most of the time, they talk about the things that everybody talks about: family, work, holidays, politics, whatever. They talk about all of those things. But the most tangible thread through it all is that they are a group of people who absolutely get what the challenges are that each other faces. And that's something, because I don't have diabetes, that I will never fully understand. And it's precious, absolutely precious. So I think peer support helps us learn, whether it's diabetes or anything else. But we also know from the work we've done on DAFNE that probably about 1,000 to 1,200 people a year who have done a DAFNE course go on to have continued peer support from that course a year later. And that is huge, huge.
It is, absolutely, because we don't spend very much time at all with our health professionals over the course of the year, but having somebody that's there that you can talk to or you can ask advice of, it is.
And yeah, I mean, I joined the call while you were talking with Gillian about the different CGMs and the different mobile phones and how they work and things like that. Those are chats that you don't have time for when you go to a clinic appointment.
Yes.
And yet they're so crucial, because if you joined Diabetes Chat this evening and you didn't know not to put your phone on automatic updates, now that somebody might know that, then they're going to be safer because they're not going to have that issue. Or if somebody didn't know about the grace period when you put on a new sensor and an old sensor, a lot of the time things like that gets lost because you only get referred to a healthcare professional when you've got a crisis, when you need hypo advice or sick day rules or exercise. And so that general day-to-day stuff is not something that you get time to talk about in clinic very often.
You don't. And I mean, it's not the fault of the healthcare professionals, because at the end of the day, they are rushed. But just having somebody there that you could message and ask a question.
Yeah.
We always talk about diabetes stigma and misconceptions around diabetes. I have friends who are type 2 diabetics, or people living with type 2 diabetes, to use the correct phrase. Um, and even my one friend says, well, you can't be type 2 because you're on insulin.
Mm.
Do you find that a lot of people that come on the DAFNE course and the Victor course are coming across a lot of misconceptions of type 2 diabetes, and therefore suffering from stigma or experiencing stigma?
One word, yes. I think there's a. Are you happy for me to chat with this one, Louise?
Yes, absolutely. Yes.
Yeah. There there are so many misconceptions in the media about diabetes, whether it's type 1 or type 2. And one of the things I learnt at Diabetes UK, I've always thought that type 1 diabetes came on really quickly, and now I understand now that we're learning more that it might come on quite slowly over years, and I had no idea about that. So I think as we learn more, that's really helpful from a medical perspective, but that never translates into the media or soaps on the telly. And somebody they'll put down that so and so is a medical advisor on a program on the television. And you think, yes, but obviously you don't know anything about diabetes because you've done completely the wrong thing. So somebody doesn't take their insulin for several days, and um, or that somebody has a hypo, say their blood sugar is really low, so they give them some insulin, and you think, well, that's really not helpful, is it? So anybody that you come across thinks, oh, well, if you've got diabetes and you have a bit of a crisis, shouldn't I be giving you some insulin? No. um, and it's just, I can't think of any other healthcare condition where the person who has it can leave a medical appointment feeling as if somehow they are to blame for their condition. I don't know. Nobody says that to you if you've got asthma, or if you get arthritis, or if you have celiac disease or thyroid problems. Nobody says, oh, it must be your lifestyle, or it must be what you ate, or it must be this, it must be that. Yeah, I think stigma's massive, and it doesn't help with social media. And social media is the best and the worst thing that's ever been invented, because we can do things like this, which is the best thing. But the worst thing is everyone's got a voice and everybody uses it, whether they should or whether they shouldn't.
Totally. I mean, I went to have a dressing changed a couple of months ago, and I think I've said this on here before. The first thing the healthcare professional said to me as I walked in was, what have you come for? I said, I'll come for a dressing change on my foot. Oh, are you diabetic? Yes, I'm diabetic. Are you a bad diabetic?
Oh,
My response was, there's no such thing as a bad diabetic. We all do our best with what information we have at that particular time. You need to go and educate yourself.
Yeah.
Which, so my
I'm
appointment didn't
staggered.
actually go very well at all, but
I'm staggered.
it
I'm
was,
staggered.
I did take it further, and she has been reprimanded. Uh,
Goodness me. I don't quite know how to respond to that. You've literally taken my breath away, and it that doesn't happen very often.
I actually spoke to my diabetes specialist nurse at the GP surgery the week after, and she was absolutely flabbergasted.
Mm,
So, hence why it went further.
goodness.
I've got just a few quick fire questions that are coming from the community. Can others attend the course, e.g. partners and carers? Is the course available for everyone who has type 2 diabetes, or just people on insulin? And
It's
does
just, sorry, go on.
the course cover GLP-1s and other type 2 treatments?
So the course is for people who are using multiple daily injections of insulin. Keep me right here, Liesl, because you're the clinical
Yes.
expert
Yeah.
here.
Yeah.
Now I've immediately forgotten your other questions because I can only hold one thing in my head at one time.
So yeah,
Can you answer the questions, Liesl?
it's for people with type 2 diabetes who use a long acting insulin and at least one quick acting insulin a day. They might be taking 2 or 3 quick acting insulins a day. It talks about GLP-1s in general terms when it talks about other medications for type 2 diabetes, but it doesn't focus on GLP-1s as a treatment. So it's not available for everybody with type 2 diabetes. I think it was James who said earlier that if you're not on insulin and you've got type 2, then there are other courses available like Desmond and Expert, which are great courses for people who have got type 2 but are not on insulin.
And I think the other
Okay.
question was,
Was there another bit?
can people attend some of the sessions?
Can partners or
right.
carers attend?
Yeah.
And I
We
think
tend,
they
yeah,
are invited to the 6-day rules. Is that right, Liesl?
yeah, we usually give people the opportunity to bring somebody along to the sessions that where it might be a crisis like sick day rules or severe hypos where you might need help from somebody else. We don't invite partners to the whole thing unless somebody has a specific need. So, for example, I had somebody on a DAFNE course many years ago who had another health condition, which meant that she needed the support of her partner. So he was, with the agreement of everybody else on the course, he was able to attend the whole course because it was just as important for him to do the learning as it was for her. But we tend not to do that all the time because then you'd have twice the number of people and the focus wouldn't be so much on the people with diabetes if their partners are getting involved in the conversation so much. It needs to be the peer support for people with diabetes. But yes, we do invite partners or close friends along for those sessions where you might need help from somebody else.
Thank you for that. We've had a comment from Kez going back to us crying. Now Casey's crying. Although she has a great team now, before the team that she's got, she cried at every appointment because she felt she wasn't good enough or it was her fault or worrying over nothing.
Oh. I just think in life we all do our best every day, whether it's diabetes, whether it's our work, whether it's our other health conditions, whether it's eating healthily. I mean, one of the biggest things I can't bear in diabetes is the word non-compliant. Louise is, the longer Louise works with me, the more she's going to hear me talk about this. The word non-compliant should not be in the medical dictionary. So I think
Absolutely.
if somebody ever accuses you of being non-compliant, you just ask them, do you eat 5 portions of fruit and veg every day? Do you walk 10,000 steps every single day? And if they say no, say, well, okay, but you're expecting me to do that and make all these other decisions about my diabetes, and you can't even do 2 things that we're all meant to be doing every day. So I think the sooner we realize that we're doing our best, and today we might be doing better than yesterday, we might be doing better than we do tomorrow. But, we do the best we can do every day.
Yes, yeah. I like that thing you do, Liesl, when you train the doctors and you ask the doctors to keep the diary.
Yes. We ask doctors and DAFNE educators going through their training, we ask them to keep a diary for 5 days. So we give them a fictional glucose diary with glucose readings in it. We give them some insulin to carbohydrate ratios, and we ask them to count their carbs for 5 days and to calculate their fictional quick acting insulin doses for 5 days. And very few people manage to do every carbohydrate that they eat for 5 days. And that's our way of trying to get them to share a little bit of what it's like to live with diabetes. And yeah, very few of them can do it for 5 days.
don't think I could unless I was doing the course.
Exactly, because life gets in the way, doesn't it?
Yeah.
Yeah. Or you just forget.
Yeah. We've got one last question come from Tom, and it's going back to stigma. Do you think the course and education helps reduce stigma?
It's difficult, isn't it? Because the stigma is applied to you from other people. I hope that by doing a DAFNE course or a Victor course, that the people who attend feel that they can stand up to other people's attitudes and not feel judged by them. And I hope that people can come away from the courses thinking that when somebody makes you feel judged or criticizes you or says, should you eat that, that actually they're just showing up their own ignorance rather than anything else, and that you then will be the expert in your diabetes. And I hope that you won't feel impacted by the attitudes of other people. That's what I hope.
Yeah, and that is one of our aims of the course, isn't it? And we ask people about about how they're feeling, or are they
Yeah.
feeling stigmatized? How are they managing? How are they feeling about their diabetes? And we ask that before the course and after the course. So we'll keep an eye on that, and hopefully,
Yeah.
if we can come back in about a year's time and we've got some results and we can talk to you about it, we'll be able to
Yes.
tell you what the results are then.
Deal.
Yeah.
We'll book it in for 12 months' time.
Brilliant.
Tom, put it in the diary.
I always love coming to talk to all of you, and because I can talk about diabetes till the cows come home, but I'm always a little bit on the edge of my seat because I never know what questions are going to come, and I quite like that.
Well, I hope that tonight's been useful to you and the community, because it's certainly been useful to me.
Listening to your experience, Claire, has been great for us, I'm sure, and Louise would agree with me, just hearing your experience of doing the course, because you're the first person we've spoken to who's actually done it. So thank you very much for being so willing to share your experiences.
No problem.
I'd like to echo that. Thank you, because it doesn't really matter what we think of it. What matters is what people with diabetes doing the course think of it.
Yeah,
So any feedback is always gratefully received, and we look at it all and we act on it all.
Well, we've got our follow-up session on the 28th of this month at Sandwell. So we'll see what happens with the other lady and how she's getting on.
Oh, I hope she's doing well. Getting a date for her op, I hope.
So, but it was certainly enjoyable and
good,
very informative.
Yeah,
I can't get the teeth in today. It's the timing up.
Yeah.
Has anybody else in the community got any questions that they want to ask Lisa or Louise? There's nothing else come through on the chats. I've been keeping an eye out, but there's nothing else come through. Well, can I just say thank you again, Lisa and Louise, for coming on. It has been a really inspirational evening. Tom sends his thanks as well. And we look forward to talking to you in 12 months with some statistics, if not before.
Thank you. And thank you for having us.
No problem.
Thank you for having us. It's really special. Thanks. Cheers, everybody. Enjoy the rest of your evening. Bye-bye.
Bye-bye.
Bye.
Wow. What an